All right. So another thing that is different is, or at least for today, is that I have changed my Zoom account. It used to be a personal account, and then I found out that it wasn't linked to the university's. They have a paid account, and I get a couple of different options. So they're a little different today, but
Mhm.
we still have chat. And so if you want to chat, I'm going to go ahead and type one in here. If we get anything really good, like so, if some people can join on and they can't do audio for whatever reason, you can
Mhm.
always chat, and I can actually save these and post these to everyone to see what's happening later. So, uh, hi everyone. Okay, so I sent one out, so you should be able to see it on your screen. That I don't know how it looks on yours, but hopefully you'll be able to see something that I've at least.
Yes, I can see.
Okay, good. All right, so I'm going to share the screen, and hopefully we'll get. I'll get the right one posted. All right. So last time I went on a little bit of a rant, and I tend to do that. So if I'm not standing in front of people, I just uh, continue to talk on my own. Um, then I just go and go and go. So I got to figure out. Okay, You should be able to see the Oklahoma State Department of Health website here. So uh, the situational update for COVID-19 in the state of Oklahoma is now, we currently have 879 positive cases, and
Mhm.
still just had those two that were um, out of state. And then we've tested 12, well, almost 2,000 folks now. Um,
Mhm.
this is still says asterisks, and Governor Stitt just announced yesterday that we should be getting all of the negatives in from the private lab. So what had happened before was that the test could be done by a private lab, but they only made a notification of a positive result, not a negative result as well.
Mhm.
Now they're going to be sending out a negative result. So we can go to OSDH reportable diseases, and we can see what diseases are there. So I'm going to go ahead and mute you for a second, just so, because I'm getting some feedback. But if you need to say something, go ahead and chat, and I'll unmute you. But we've got these reportable diseases here, and you can see what to report. And now we've got, so these are immediately upon suspicion, and we should have coronavirus on here. I would imagine they should have updated it. Novel coronavirus. Okay. So that means that immediately upon suspicion, diagnosis, or positive tests. So because of that, uh, they have, that includes negative tests. So if you think that they are, you're supposed to report it. And so they send in a digital lab report uh, to the state health department, and they collate those results. And so we should get better results, because right now we don't know the denominator. We know the numerator, but of positive cases and of deaths, but we don't know how many people have actually been tested. And that's kind of important to know if we really have a good number or not. Um, we've got a breakdown of who's doing the testing here. And then we have a breakdown of ages. And so we're continuing to see a large group of folks that are elderly testing positive for that. And also 24 of the 34 deaths are of the elderly 65 and older. So that's definitely a consideration of concern. Something else that's very interesting from the last couple of days, we had a big jump of about 15 people since we've last met. And we can see that we have a large proportion of males dying to COVID-19 in Oklahoma compared to females, which is a consideration. Now, I have heard as well that uh, everyone who has passed due to COVID-19 has had, it was either uh, very elderly or had underlying conditions. So they're either 65 or over, but everyone here that wasn't 65 or over, so these other 10, they either had heart disease or diabetes. So that's a concern. And then we can continue to scroll down. So they've got the cases by county, and we can see on this map, I'll zoom out a little bit, all the red counties are where there is active cases, or there has been an active case, and then the yellows are where deaths have occurred. So it's pretty spread out. And I've just heard that the governor has issued his emergency safer and home executive order, which is kind of cruddy for statewide. We've got this graph here that shows quite a bit of an upward trend. So is this really happening in Oklahoma as this graph shows? We don't really know because testing has been so poor. And we still have so little testing that we don't know if this is actually a true number or not. I suspect it to have been more something like this. I'm going to go ahead and I can do some annotations on here. I want to draw what I really think that our graph in Oklahoma probably looks something more like this. And it might even be higher than that. But I don't think that we are seeing this actual true peak or this very steep, this line here. I don't think it's that steep. I think it's more something like that. And the reason being is because we're not testing enough. And we haven't been. But we now, and I'm not going to speak for the governor. I'll let you hear him say what he's going to say. But we're now have better testing capabilities. So let me find my YouTube video. I just went crazy after I was looking at this. Here it is. So I've got some times that I want for you guys to listen to. So at the beginning, we'll just listen to the first few minutes of what he's saying. So we'll go ahead and get started again. Okay. Can you hear me, or is it just the audio on the
Yes,
video?
I can. Yeah, I can hear you, but it's just the audio on the video.
Okay, I'm sorry about that. Let me see what I need to do. I thought that was set up. Go to more, and has something to do with my audio. Oh, so I can hear him. Let me see if I select same as system, if that's changed. Okay. Can you hear that?
Like it's like really small or something, but no, I cannot hear it totally.
Okay, I just stopped it. I'm gonna turn up the volume on this and see if this will work.
Okay.
Go back and how about that? Is that louder?
Like it's really, really small.
Okay.
I think you can just put up the link so we can look at it.
Yeah, I'll just do that. Okay, so just watch the first, 3 or 4 minutes of that, just so you can hear the announcement. Okay, and then I've got some other times that I'm going to post for you guys to listen to. But I'll tell you essentially what. So that some people called in, and it's around. Let's see, the time is 21 minutes. So he goes on and on and on, right? He's a politician, of course.
Mm-hmm.
That's fine. So we around 21 minutes, 37, someone calls in and asks a question. Um, all right, let me see what they have to say. Can't remember exactly which question was first. Oh yeah, so this lady calls in and she's asking about shelter in place. And the governor says, well, I think that the better, safer at home policy is appropriate for what's going on in Oklahoma today. And I just wonder, he says that, but I'm curious if he I know he has seen the numbers, but how can he say that when these numbers are going like this? The safer at home policy is not a shelter at place.
Mm-hmm.
You can still have essential businesses open, and okay, and you think, well, no, essential businesses are important. So the next one, someone asked another question, and it was at 26 minutes, and it's pretty outstanding what the not the question but the response. Wow. So the question was, many people are asking to get hairstylists to come to their house to do hair dyeing and cuts and whatnot. Are you going to make an exception for that? And he goes, that's a great point. I'll take it into consideration. What his response should be, if he is actually serious about stopping the spread, is absolutely not. That is not essential at this
Yeah.
time. So it's
Mm-hmm.
pretty ridiculous. I found that he's really just doesn't understand that it's not serious. And I thought, well, that's kind of interesting. At the beginning of this outbreak, we had seen his board here that had been sitting next to him. Right
Mm-hmm.
now, there's Dr. Casey Schramm and then Jerome uh, LaRidge. And I looked up to see who they are. Well, Dr. Casey Schramm is a uh, osteopathic doctor, so she's not an MD, but she's a DO, and she doesn't have a lot of
Mm-hmm.
clinical experience. What she does, she has a lot of educational, administrative experience. So she's not really even in
Mm-hmm.
practice. She just teaches
Yeah.
students, but not even
Mm-hmm.
teaches students. She's the dean, so she doesn't really teach a lot. She's actually more of an administrator now. Doesn't have a lot
Yeah.
of infection prevention experience, which is pretty unfortunate, I think. The other person, Jerome LaRidge, excuse me, is an energy industry executive. He has no medical experience or knowledge. Why are they even there? Well, don't we have the Oklahoma State Department of Health and Gary Cox as a commissioner there, and we have a state epidemiologist. Why are they not there? It just seems very out of whack, and they obviously are just doing whatever they want to for businesses and not for the safety of the state, which is very unfortunate in my opinion. But I'm not going to rant more about that. Um, so anyway, we're in a very interesting situation within our state, and so many people are being exposed to this, and we just don't know who. So we've got 5 confirmed cases in Pontotoc County, so
Yeah.
that's pretty serious. And you can still walk into Walmart, and people just
Yeah.
are
People
still
are still walking every day. Yeah.
yeah, and it's okay to walk outside if you have social distancing, but they are not.
No, no, it's not totally. No, there is no total social distancing at all. Like when I went to the Walmart last week, I believe
Hmm.
people were all like busy shopping and everything, and there was like no social distancing at all.
Yeah. Uh, I know that people need to get food, but you should be stocking up as much as you can and avoiding going out.
Yeah,
It's
it's been
not
almost.
going out every
Yeah.
day. It's not
Hmm.
what we should be doing.
Yeah, I have tried my best to like stay away from everything. So it's like almost a week and more. I have not been outside at all.
That's very good. I think that's quite wise. Uh,
Mhm.
so one of the concerns is for testing for the coronavirus, and we don't have good testing capabilities. But they have a new little self checker, which is pretty cool. All right, so you agree to give them some data if you want to, but you go in and say, yeah, where you are, and then it loads up. So this is just a quick little, I guess it's a artificial intelligence style, but you can pick
Mm-hmm.
where people are, and it really gives it helps with some information. And then you could say, are you ill or caring for someone who's ill? No. Okay. Sounds like you're feeling okay. All right. So don't worry about it, and you don't have to test. But if you do say yes, then um, I don't know if I can go back, and you can't change it after you've done it. But you can go through and
Mm-hmm.
answer questions, and I think it's actually something good because they're getting bombarded with all these questions about
Yeah.
coronavirus. Let's look and see about our national numbers. And so, if you want to scroll, we can scroll down here. Cases in the United States, so 200,000 and almost over 4,500 deaths. It's pretty serious, and we're still,
It's pretty bad compared to everything.
yeah, it's pretty serious, and it's gonna
Yeah.
get, this is going to continue to rise, and I expect to see these numbers really jump up. Now this is from yesterday, and so it's actually good. This is a federal government posting data just a day behind, which is, it doesn't happen that way. It's usually weeks, but we've got those coming out. And then this is actually, when did you start getting sick? And we don't know this last section, so it's still unknown. But I feel like at least they're doing something now. The president's response has been, from a public health standpoint, has been horrible and
Yeah.
confusing and unrealistic. And but numbers come out at 4 p.m. The day before reporting. So if you're interested and you want to check this out, check it out after 4, usually
Mm-hmm.
4:30, and they got the new numbers. But if you haven't and you're interested in signing up for the Oklahoma State's numbers, you can click on, they have a link on their website that you can get email updates. And so every morning I get updates when they post the new numbers, so you don't have to check in multiple times per day, which
Mm-hmm.
is kind of nice. But anyway, okay, so I have lots of opinions about COVID-19, and I think that uh, we should be sheltering in place as much as possible. If you go out, you should be wearing at least a DIY mask. Uh,
Mm-hmm.
and the concern is that there's so many people that could be asymptomatic, but more likely you're going to be pre-symptomatic, and you can be that. There's evidence of up to 3 days before you get any symptoms, and you could be spreading the virus. And it's
Mm-hmm.
spread through respiratory droplets. So again, if we wear this is it says save the mask. What you should do about N95 respirator. I'm not encouraging people to wear these because
Mm-hmm.
they should be safe for our healthcare workers. But a non N95 respirator or mask could stop droplets coming from your mouth into either the air and going into someone else's mouth or onto surfaces. And when people pick up the surface or touch the surface, they can contaminate themselves. So if we're all wearing masks, we're not spreading it. And the reason that it's not to stop it for someone else from getting it, it's to stop us from spreading it. And so if everyone wore them, no one would be spreading it, and it would stop the spread. Uh, I'm not going to say completely, but it would greatly reduce it because it comes out through respiratory droplets. And those are collected by a face mask, whether it's just a simple DIY one, or if it's a store-bought one, if it's a reusable one, or if it's a disposable one, doesn't matter. If it stops the
Mm-hmm.
droplets from coming out, and you're going to prevent that spread. It's very confusing though, because no one's saying to do that. Now they're starting to consider, that maybe you should do that. But they didn't want people to make a run on the mask, and that's why it hasn't been announced. So it's
Mm-hmm.
kind of, you get some confusing updates. All right, I'm going to now see if I can share this. I think I can start that. Can you see the slideshow now? Is that
What was it? Just a second. Your screen, yeah.
Okay. So I'm going to turn off the videos, and we're just going to look at the presentation, because I think that's easier. But we're going to move into some topics within the book. So I know we still have chapters 6 and 7 in our book to finish up.
Mm-hmm.
We're going to look in today about what's going to be in chapter 6. So most of these lectures are going to be updates on coronavirus, and because it is relevant, and then we're going to go through and look at some of the other stuff that's in the book. Now, I mentioned on Tuesday, I know everyone's not going to be as interested in anything else, and it's quite hard to even think academically or read or without being interrupted. But we're going to try to push through it, and hopefully it'll be okay. So moving forward with our chapter 6, I'm not going to look at everything in chapter 6 as it is written out in the book, but we're going to cover communicable diseases and non-communicable diseases. So that really kind of covers within the title of chronic disease as non-communicable diseases is really what we're thinking. And then communicable diseases, we're in a huge communicable disease outbreak. So we're going to talk about those. We're going to talk about how the effect of aging, what that has on global health, and of aging and dying, and how we look at that in global health systems. And then we're going to look at maternal and also child health, because those are both very relevant within global health challenges, specifically for lower gross domestic product nations. So let's get through. Those are the topics. So if you look in your book, they're kind of broken out into several sections, but those are the sections that if you're going to read, you should read those, and that's what we're going to be discussing more. We'll get through some definitions to start out with, and so we had some of these on our exam, but they were already given. Just a reminder of what prevalence and incidence is. Prevalence, proportion of population found to have disease or risk factors. So those are the folks that already have a disease, and those can be at any given time. So it's not just new cases, because that's what we're going to talk about next, because that's what incidence is these are new cases. So that's the important thing, the important difference. New cases over a given period of time who are at risk. So if this is what we might be concerned with of new cases. If we're thinking about coronavirus, we've got lots of new cases that are going on. We may not be concerned about the prevalence of coronavirus, those who had it and are no longer infectious, but the new cases, how quickly is it spreading? And this is really important when we talk about other types of diseases as well, especially chronic diseases. Prevalence, you can live with a chronic disease for multiple years and it not be a big burden. But if we're seeing a spike in incidence, then that means it is spreading. But we'll look at how chronic disease differs from communicable diseases. Morbidity, we've talked about this, proportion of sickness in a specific territory, or you could think of morbidity rate. Sickness, the difference between morbidity and mortality is you have the disease or you have the illness and you haven't died, and then mortality is that you get it and you have died. So the deaths is the big difference. Morbidity, something you could say very morbid, right? That's why I always think of, oh, it's a very morbid topic. Well, that's a very scary or very bad topic. So it's bad that you get it, but if you never say it's a mortal topic, right? We think of mortality, and that is mortality rate, the number of people dying. Okay, how can you get a communicable disease? So there's a couple different ways, but one of them is a vector. So that's an organism that transmits an infectious disease or an infectious agent. An agent is not really a disease, but it could be a microbe, it could be a virus. Those are both agents. A disease is once that agent takes hold and starts to make a person ill. Then you have a disease. And the vector takes the agent from a reservoir to a host. So The reservoir could just be the environment. It could be another human. It could be an animal. And then a host is the person who's going to be ill. In this case, when we're looking at human sickness and human disease, the host is the individual, is the human. So example of this that we're going to talk about is mosquitoes. Right? So the vector is the organism that takes the agent. So if we're talking about West Nile virus, a mosquito will take the viral West Nile virus from wherever it is, perhaps the reservoir of birds or of horses, of any mammal, and then transfer it to a host, which is the human. Okay. A case, you have to have that particular disease, right, to be a case. So if you're just if you're infected, but you're not classified as having the disease, then you're not necessarily a case. So we'll look at that. You actually have to have the disease, a classification of the disease to be considered a case. And so that can be a little bit tricky sometimes, but I'll make sure, I'll try to keep it easy. This isn't epidemiology. We talk way more about that in epidemiology compared to this course that we're doing. All right, case fatality rate. So when we look at, when we saw those numbers for coronavirus, the case fatality rate would have been those people that have died compared to those people that had the condition. And that would have been a case fatality rate. That's different than what we might consider as a mortality rate. So the mortality rate, or case fatality rate is deaths over infections, or cases, excuse me, deaths over cases. Mortality rate, so if you were to call it a mortality rate, that would have been deaths over population at risk. So please forgive my poor penmanship. That's about what it looks like if I was writing with an actual pen. But I'll give an arrow that if it was a mortality rate, the death over the total population that you're considering, compared to a case fatality rate, meaning it's deaths over the actual cases that people that actually had the disease. So currently we can currently get the mortality rate for coronavirus, but we can't get the case fatality rate because we don't know how many people actually have the disease, and that's a concern because that's really that's very important to know. Okay, let's continue on, and I'm going to clear out my annotation so I'll move forward. Hopefully, not spend too much time. And if I can get this to click up. Okay, so we've got some other definition. Elimination of disease. We want to reach actual zero incidence of a disease, so no new cases. And it can be over a period of time. No new cases for usually for several years if we're talking about total elimination of diseases. So some diseases have been completely eliminated. Well, very few, I say. We thought that we had measles. That was really, really close to being eliminated. We had polio, and then we started to get some new cases of that. So currently, smallpox is considered to be eliminated. So that's great. The difference between elimination and eradication is complete elimination of the disease and its causative agent, meaning that the actual virus, polio virus, is gone. That has not occurred. That is going to be always going to be present. It's going to be it's left out. Viruses can survive, in very strenuous environments, and unless we actually go through and identify every place, it's not actually going to be eradicated. All right, so when we think that they're gone, and then they come back, like this would be measles. In America, in the United States, an existing disease we thought we got rid of. It has increased in incidence, definitely. Another re-emerging infectious disease would be influenza, right? If that comes down, typically we think it to be seasonal, but when we have if we were to get another strain that came out and has taken new forms, that would be like the influenza virus mutates, as we know. That would be considered a reemerging infectious disease. Concerns for this was with Ebola as well, thinking that it might have mutated. So when we see taking on new forms, we kind of think of mutation. I'm just going to write, I'm going to save us all the pain, and I'm just going to write mutate. All right, antibiotic or antimicrobial, product that kills or inhibits the growth of a microorganism. So we have lots of antibiotic hand soap, and that they have specific product in them that is known to kill little microbes. That's not necessary to use when we wash our hands. Actually, just good old lye soap works pretty well. And they found that without putting any antibiotic material in there or antimicrobial material, it works just as well. But it's a good selling point. Now, an antibiotic doesn't just have to be in soap, right? We can think of actually treatment or care. Antibiotics kill or inhibit the growth of multiple bacteria, and that's a very common treatment that we use and that is given out globally. And so a concern is that as we continue to treat with this, what happens if we treat an illness, we have symptoms that we think that it looks like it could be a bacterial infection, but we don't know for sure because we don't have the time to make a culture test. And so we treat it anyway with an antibiotic. Well, what happens if it's not really there? Or what happens if you don't finish your dose of antibiotics? Well, then sometimes these bacteria can become resistant and survive those antibiotic treatments. And then we get antimicrobial or antibiotic resistance. And that is a very bad thing. We see that a lot in the United States, mainly related to hospital HIAs, hospital-associated infections. That's when we see this a lot in the United States, and that's a concern. And globally, it is also a concern because as they become less effective, as antibiotics become less effective for certain bacteria, you have to have more powerful and more expensive and sometimes very difficult to use or to treat with because they are less robust. They cannot survive in an environment as much as some of these broader range antibiotics can, and so that's a concern. All right, epidemics. So we're currently in a pandemic, but this isn't epidemiology, but we need to know that it's the occurrence of disease cases that exceeds what's expected in a given region. So for us to be in an epidemic or a pandemic, right? I'm gonna write this in. I mean, you're getting a special dose today. A pandemic. I'll put a slash here because they're both related. You have to have a disease, and you have to know the cases, and they have to be greater than, right, what's expected. So how do you know what's expected? Well, you have to be tracking, you have to have records, and you have to be testing for what is going on. Do we know that this is a pandemic? Well, yes, because we weren't expecting any coronavirus to be in human populations. That's why it's called novel, right? If it wasn't novel, then we would already have known about it, and we could have expected it. Now, to have an epidemic of measles, or excuse me, not measles. What if we were to consider an epidemic for smallpox? What would the epidemic? How many cases would we need for an epidemic of smallpox to occur? Well, in the United States or anywhere in the world, we need to have at least one case because we're expecting 0, right? So if we had one case, that's way more. That exceeds what we expect. So if we're expecting only 0 cases, then one case could be an epidemic, and it would definitely be a public health concern, global health concern, because this is supposed to have been gone. So pandemic just means it's an epidemic, but it's crossed international borders, and really not just international borders, but you want to think of continents, and it's gone across the globe. So if you hear global pandemic, it's kind of like saying ATM machine, right? Automatic teller machine. A global pandemic is just a pandemic as well. So, but we use terms a lot of times that uh, you know convey the true meaning or the true feeling of what we're trying to share. So, okay, I think I've gone on for quite some time. I'm going to stop the video real quick, and I'm going to start a new one. If I can get to my recording settings, because I forgot. I've been just going on.